We are Team GLAD, and our company is Jacobs Medical Center, located in San Diego, California. Jacobs Medical Center is a 364-bed hospital founded in 2016. It serves local and regional communities by forming strategic alliances and strong partnerships to help and educate others. Their work focuses on outreach to underserved communities and members of health disparity groups.
We formulated questions that we knew would help prove why the structure of Jacobs Medical Center fosters an environment that maximizes job performance and how the goal-setting theory can explain the motivation of employees at this company. The first question we asked was, what goals have you set for yourself that have allowed you to monitor your progress within the company? How does JMC assign specific and difficult goals for its employees? Are there any incentives given for achieving goals? If so, has that played a large role in motivation to push for achievements? Are there any procedures in place for employees to receive feedback? Do evaluations allow you to feel more motivated to achieve any specific goals in place? And lastly, how long have you worked at JMC? The goal-setting theory explains how employees who are given specific and difficult goals will experience higher levels of performance. As the figure shows, several factors including feedback, task complexity, and goal commitment can explain the strength of the relationship between self-set goals, intensity and persistence of effort, and task strategies. Difficult goals are ones that challenge employees to perform at their highest level while staying realistic. This applies to the employees we had a chance to interview at Jacobs Medical Center because while they each have their own self-set goals, it's crucial that they are motivated by challenges in which safety and ethics are still the number one priority.
Jacobs Medical Center assigns specific and difficult goals to individual nurses on an annual basis. Every year, the compliance department of the hospital conducts a safety compliance survey. These surveys track the performance of a nurse during patient care interactions. Nurses work hard to score high on these surveys to potentially receive a pay increase. This, in turn, has led to nurses enrolling in continuing education courses to be more proficient at their jobs. This allows the nurses to take on more specialty roles within a particular unit.
After people's own goals have been set, it triggers both intensity and persistence of effort. While having self-internalized goals largely affects task performance, the 5 employees that took the survey mentioned incentives that would act as extrinsic motivation. External rewards such as pay and raffle gifts contribute to higher intensity of effort. One of the nurses who took the survey said, quote, "During evaluation time, our manager assigns specific advancement goals based on unique nursing skills. Achieving these goals results in higher evaluation scores, which can result in higher pay. Yes, it has played a large role in motivating me." Unquote. Additionally, 2 other nurses mentioned how specialty roles that incur more responsibilities are incentivized by a paid differential. This motivates employees to work harder towards a promotion or a step up from their current job. For example, one nurse had said, quote, "Specialty roles such as a transplant nurse are given to nurses who take initiative to acquire the proper education and experience to care for more complicated patients. This year, my goal is to take the proper steps to become a transplant nurse." Unquote. Persistence of effort is also demonstrated as this employee of 3 years is in the process of working towards becoming a transplant nurse. He is motivated to increase initiation by receiving more training and schooling. As a result, both intensity and persistence of effort contribute to task performance.
One of our survey questions was if there are any procedures in place to receive feedback, and if these evaluations allow employees to feel more motivated or to strategize their specific goals for various tasks. Each employee explained how there are both annual evaluations and monthly unit performance scorings, in which a quality control nurse ensures each unit is performing efficiently. Additionally, patients are given questionnaires to provide feedback on each nurse's performance. These forms of feedback can explain how employees at Jacobs Medical Center obtain motivation to meet each goal due to the various methods of feedback, and that goal progression is tracked through specific strategies. The theoretical aspects of feedback and task strategies are congruent with task performance at JMC due to these reasons. Employees are well aware that working smarter, not harder, is crucial to meeting their specific goals, and awareness of each employee's progress towards their goals through patients, peers, and supervisors ensures that job performance and motivation are increased. Getting evaluated on how well each employee met their difficult goals adds another layer of intensity and persistence. As the figure shows, task performance increases when difficult tasks are set.
The goal-setting theory has a couple of factors, or moderators, that help link up the theory and show how each step is interconnected. One of these happens to be task complexity. Task complexity reflects on how complicated the information and actions involved in the task are, and how much the task changes. The effects of the specific and difficult goals are almost twice as strong on simple tasks as on complex tasks. Now, this doesn't mean that these complex tasks aren't beneficial. They still are. Each nurse's job is complex because most of their patients' lives could be at risk. This in turn makes sure that the nurses are motivated to keep doing a good job. The second moderator of the goal-setting theory is the goal commitment. The goal commitment is the degree to which a person accepts a goal and is determined to try and reach it. In the case of Jacobs Medical Center, the strategy they use would have to be rewards mostly. They use rewards in the sense of when they use their JACO surveys. Each nurse has to fill out a survey, and if the ones who score the lowest are talk to the manager and they'll give them help, but the nurses who take the initiative to actually achieve the goals that the bosses gave to them will be put into a raffle as an incentive gift.
Our recommendations for Jacobs Medical Center is to establish clear and measurable goals for its employees. With so much change and uncertainty occurring in healthcare, having a strong goal system enables organizations and their employees to connect in meaningful ways. It motivates individuals to create and participate in a strong culture of performance. Goal-setting systems ensure that when a goal leaves the executive suite, it is tied to people and processes all the way down the line. It is in this setting that staff begin to understand the difference their work makes outside of their daily domains.